Good evening. Good evening. Thank you so much for joining us once again. This is Salem Consultants. My name is Anne Karambu Mwangi. I am a counseling psychologist at Salem Consultants, and my prayer is that today we will continue to learn more and more, just get to understand who we are. Sorry for that. Okay, sorry for that technical hitch. So I was saying that my name is Anne Karambu Mwangi. I am a counseling psychologist with Salem Consultants. And it's my prayer that even as we continue learning more on our mental wellness, that we will get to understand who we are. We will get to get awareness that is going to help us to assist the people around us. And when we find ourselves in this place where we need to take care of our mental status, we will know what to do when. So today we will be, our topic is demystifying mental illness and stigma, demystifying mental illnesses and stigma. I'll just be having a short conversation on the same within a very short time, and then we will come back and answer a few questions here and there. Last time we talked about symptoms, symptoms of mental illness. We talked about how to know that someone has a mental health issue. What are the things to look into? We also looked into the factors that contribute to mental illness. And today now we will be specifically talking about mental illnesses, a stroke disorder. So we will define the two. We will define what is mental illness, and then we will also have an opportunity to define what is mental disorder. So mental illnesses, these are mental health conditions that significantly affect a person's thinking, emotions, and behavior. There are health conditions that significantly affect a person's thinking, emotions, and behavior. So for it to qualify to be called a mental illness, it is presenting itself with affecting a person's thinking, how they think. It may be distorted. It also affects emotions and also affects how that person behaves. And some of the mental illnesses that we'll be looking at today are mental illnesses like depression. We'll be looking at anxiety disorder. We'll be looking at bipolar, schizophrenia, and eating disorders. So, of course, anxiety disorders, of course, a person responds to certain objects or situations with fear and dread. That person can also experience a rapid heartbeat and sweating. Anxiety can come also as panic, disorders, when we are talking about a rapid heartbeat, when you remember those situations or things that have happened to you, it comes with that rapid heartbeat and sweating. If someone has this illness, they need treatment by a professional doctor. Then, of course, we have mood disorders, which involve affective disorders. They involve persistent feelings of sadness or periods of feeling overly happy or fluctuations from extreme happiness to extreme sadness. They include depression. There is, we said, bipolar, and there is, of course, all those other disorders that are associated with mood. We are talking about feelings of sadness and times of feeling very happy. So when we talk about, of course, depression, we are talking of extended times, which goes beyond 2 weeks when you are depressed or feeling sad. You're not able to even clean yourself. You're not able to take a shower. You don't want to get out of the house. You don't want to get involved in anything for an extended time of at least 2 weeks. That when those feelings are there and those feelings are extended. The reason as why we are explaining depression that way, it is because you may feel those feelings might come and go within a short time. They may come and go within a day or two, and then that does not qualify to say that person has depression. And those disorders or illnesses can only be diagnosed by a doctor. Avoid diagnosing yourself. I know, of course, we are living in times when people are a little bit aware of mental illnesses, and there's a lot of self-medication that is happening. You find people wanting to treat themselves, and in the process, of course, you give yourself the wrong medication. Then we have bipolar, which I will not again explain so much on the same. This is extreme seasons of sadness, and there are moments where there is a lot of, it fluctuates to a lot of excitement at the same time. So for bipolar, they have to combine. That is the time it can be described as the bipolar. And then, of course, there is the issue of having uncoordinated thought patterns, or having hallucinations, or seeing things that are not there. So there is moments of extreme sadness, moments where there is a lot of happiness, but there is also disorder. There is lack of coordination in terms of our thinking, or having hallucinations, having thoughts that are not real. And then there are illnesses like schizophrenia, which again has a lot of manic or incidences when our thoughts are distorted completely. The person may even a little bit become violent in such times, or the person may also be living or saying things that are out of reality. Then there are eating disorders, and we'll be mentioning something like bulimia nervosa. There is the other one where you're so preoccupied with weight and so preoccupied with food and how you look that someone may be very their weight may not be as much, but they don't want to eat because they think they are very big. It is a disorder that comes, and of course, someone may refuse to eat for an extended time. And every time you tell them about eating, that person will say, I don't want to eat because I am very big. Or they will eat so much and then go and induce vomiting. That is the bulimia nervosa. So these illnesses are diagnosed by mental health professionals. That is what we said. It is good to avoid self-diagnosis or even diagnose your friends. I know there is a lot of that today. Then, of course, there is experiencing some symptoms of mental illnesses does not necessarily mean that you have the condition. All those things I've mentioned, the sadness, the happiness, the hallucinations, all those symptoms that may be common to mental health illnesses does not necessarily mean that that person has the condition. So what are some of these common warning signs of mental illness? What are these common signs? What are these that when I see them, I can maybe go to a doctor now and ask, of course, to be checked on the same. Number one, feelings of sadness or feeling down or irritable for an extended period. Having a confused thinking or reduced ability to concentrate. Like if you're in school, you're in class, you're not able to concentrate well, or you're not able even to concentrate in a conversation. You feel after a certain time you're lost. Then there is excessive fear, worries, or feelings of guilt. Excessive fear, worries, or feelings of guilt. There is extreme mood changes from highs to lows. Remember, this is a little bit more associated with bipolar illness. Then there is withdrawal from friends, family, and activities that you liked before. There is significant tiredness all the time. You just want to sleep or you don't want to do anything, low energy and sleeping problems, either oversleeping or under sleeping. There is detachment from reality, which is associated with delusions and hallucinations, inability to cope with daily life, work, or school, trouble understanding and relating to others. There is alcohol and drug misuse, and major changes in eating habits. Remember, we've talked about eating disorders, and there is excessive anger, hostility, or violence. So when these common warning signs, if you see more than 3 together, then there is need to seek medical support. You shouldn't diagnose yourself, but it is good to now go further to a health professional who is going to guide in those areas. I hope we've been able to get them, and we will be able to use them to assist us in being able to tell, am I having a challenge? When these signs and symptoms cause significant distress or impair daily functioning, a mental illness may be present. So when I am sleeping for a whole week and I don't want to get out of the house, I don't even want to take a shower or eat or nothing, then this can be an indicator that something is wrong with me mentally. Or maybe I'm having those hallucinations or delusions, or all of a sudden have not been using drugs, but now I start either using drugs or doing things that are self-harming, or things that affect even how I relate with the people around me. So we've said when these signs and symptoms cause significant distress or impair daily functioning, a mental illness may be present. What are some of the effects of mental illness? Effects of mental illness, some of them will be feeling like you are trapped in your own mind, feeling like you're trapped in your own mind, and somehow you're not able to get out of that place. It is so those thoughts that are running in your mind, if it is thoughts of loss or fear of something that happened in the past, or maybe it is even lack of money or something that is happening. Those thoughts run in your mind and you cannot even think straight. Those are some of the effects. Of course, distressing thoughts, sometimes thoughts of self-harm, or thinking even of harming other people around you. And then overwhelming emotions. These emotions include sadness, include, of course, anger, the feeling maybe most of the time annoyed and distressed, and almost wanting all the time to fight back. Those overwhelming emotions will come when the mental illness may be present. Cause disruptive behavior, doing things that are abnormal, or they are not the normal way of doing things. When you find yourself, you're doing disruptive behavior, or you're in a place and you're doing things that are not in line with what everybody else deems normal at that particular time, then there is, of course, isolation. All the time, you want to be closed in. You don't want to be with people. So we look into the stigma surrounding mental illnesses. There is stigma that surrounds mental illness, and this is one of the reasons why many people don't seek help. Society, I believe it's because of where we are coming from, where mental awareness was not as high as it is right now. So society views mental illness, patients with mental illnesses as weak, unstable, or even dangerous. Sometimes society views people with mental health issues as weak, unstable, or even dangerous. Sometimes even you hear a family member telling a person who is maybe depressed that they are looking for attention or craving for attention, or they are not strong enough. Of course, for the men, you hear somebody telling you, be man enough, man up. But it is because and of course, this will cause some stigma. That means if someone even is having these challenges, they will not be able to speak about them because they are fearing to be victimized by the people around them. And then, of course, it also makes patients fear to seek help, fearing judgment and discrimination. We've seen situations where when someone has a mental health issue, either they are discriminated in the family, sometimes closed in closed doors, and left not to interact with other people, because some people start feeling ashamed about them, and they don't want to be associated with them. Of course, now the patient who is going through this might feel even shy of saying they're having the challenge because of how they will be viewed. Other people think that mental illnesses are character flaws. Someone looks at it as a character issue, and sometimes even becomes very irritated with how that person is behaving, yet it is a mental illness, and it is causing that person to behave that way. No wonder then the reason as to why we need to be more aware of mental illnesses, so that we can be able to support ourselves and also support the people around us. It can affect anyone regardless of age, gender, or background. Mental illnesses can affect anyone. It does not only affect the poor, it does not only affect young people, it can affect anyone. I've had people hear someone is depressed or has anxiety, and you hear somebody making statements like, why are they behaving like children? You know, that those statements, because of course I want to believe it's lack of awareness. And then there is of course seeking help is a significant answer of strength and self-awareness, not weakness. So many people think now, if I look for help, I think I am weak or I don't know myself. So seeking help is a sign of strength and self-awareness and not weakness. So it is important to go and seek help if you find yourself, especially with the symptoms that we've just mentioned there. Now, we've been explaining mental illnesses. And of course, sometimes we may confuse mental illnesses with mental disorders. So mental disorders are behavioral or mental patterns that causes significant distress or impairness of personal functioning. They are behavioral or mental patterns that causes significant distress or impairment of personal functioning. The mental illnesses are part of it, but now when we talk about disorders, there are also other developmental disorders that may present themselves in a mental way. We are talking about disorders like autism, attention disorders, hyperactivity. We are talking about personality disorder, substance use disorder. We are also talking of sleep disorders, and not all mental disorders are mental illnesses. Because you see now, like the case of a developmental disorder like autism, it cannot be treated the same way as a mental illness, because it is not. It is a developmental disorder that presents itself as a mental disorder. No wonder then it is very important to make sure that it is a healthy professional that is treating any kind of mental illness that we find ourselves in. So we've mentioned personality disorder, substance use disorder, sleep disorders. We've mentioned developmental disorders and things like attention disorders and hyperactivity. Some of these disorders are associated with our the development of a person. So that is purely a physical illness that has presented itself as a mental illness. So if I am to then seek help from a person that is not a professional in this area, I might have a confusion. So how do I get treatment? Treatment and management of mental illnesses. Of course, there is psychotherapy. Psychotherapy is where someone goes to a counselor or a therapist, and you are able to go through your challenges and the things, what is happening. And through having a conversation with the therapist who is also trained to offer that, then they are able to give you support. And in the process, you will be able to get treated, and the mental illness can be managed. The other one is medication, where, of course, you see a psychiatrist who now administers drugs according to the diagnosis of the mental illness that has been found. Then there is, of course, lifestyle change. If maybe the stress levels were being, or the mental illness was as a result of a certain lifestyle, you're in, or maybe some eating habit, or maybe not exercising enough. So those lifestyle changes can also be part of the treatment. You can also have a combination of all: psychotherapy, medication, and lifestyle change. And the holistic way of finding help in matters mental illness, the best strategy is having a holistic approach, being able to have psychotherapy, medication, and lifestyle change all together. There may be setbacks, of course, in the recovery journey. So patience is required, persistence, and strong support system. Many people who are have mental illnesses relapse. Relapsing is when we go back to the illness comes back in the same magnitude it was. One of the reasons as to why many people relapse, it is lack of strong support system, lack of patience, especially with the people offering support, and now the persistence of the patient. So this is not something that I will get medication today and tomorrow the headache is gone, because this is not now like a physical illness. So of course it may take months, sometimes it may take years. There are some medications that people have to take for a lifetime. Therapy sessions are not easy. They are painful, because sometimes you're going into a pain that you have covered for many years. So it is a painful experience, so which requires a lot of persistence, requires patience, and also requires a strong support system around you. People who are supporting anyone that has a mental illness also require support, because sometimes it can be very frustrating for the caregiver, because one, sometimes you may not even understand what to do or how to support that person. So the caregiver also requires a lot of support. So in conclusion, so what is mental wellness? It refers to the overall physical well-being. It encompasses how we think, feel, and behave in various aspects of life. So for me to be mentally well, I have to be thinking well, feeling well, and behaving right. So a combination of of all that then says that I have mentally well. Good mental health doesn't mean the absence of mental health problems. Good mental health doesn't mean absence of mental health problems. Rather, it's about having the positive, it's having the ability to be able to manage situations that come in a healthy way. So mental wellness, or being mentally healthy, does not mean that I will not have problems that are going to be associated with my mental health. But then when I am mentally healthy, I am able to cope with the challenges that happen in life, and I will have the resilience to go through life with the strength. So what is the importance? Why is it so important to take care of my mental wellness? Number one, when I am mentally healthy, I will be self-aware. The other one is, when I am mentally healthy, I will also take care of my physical health. Because some mental health issues have a physical implication. I remember when we were introducing the topic the other week, we said, when I have mental health issues, they may present themselves as physical illnesses. Things like body pains, joint pains, back pains, headache. They may present themselves as physical illnesses, yet it is a mental health problem. So I will be physically healthy and mentally healthy. The other thing, of course, is relationships. I will be able to establish healthy relationships. The other one is that I will be more productive in terms of work, in terms of education, in terms of even family. Because I am mentally stable, then I will also be physically, I will be stable socially, economically. I will not waste money to to because I am trying to heal my physical, my mental health, my mental issues by misusing money. Maybe I am having a stressful situation, and because of the stressful situation, I am taking a lot of alcohol, which I am using money. So then it means I will be able even to manage my money better by just taking care of my mental wellness. Of course, the other one is being able to tap into our potential. A person who is mentally healthy will be able to exploit their potential, exploit their talents, exploit their abilities, use those abilities for the right purpose and not the wrong one. When I am mentally unhealthy, I will do things that are self-destructive, and they can also destroy the lives of other people. So the benefits are many. No wonder then the reason why we need to take care of our mental wellness. And of course, understand so that we can also assist the people around us. So thank you. I will share up to there, then I'll be able to pick questions that will come. I believe we've been able to be empowered to take care of ourselves and the people around us. Thank you. Welcome, Amy.
Fantastic. Thank you so much, Madam K, for that very comprehensive discussion about demystifying mental illness and just talking about the stigma that is around mental illness. And you said something so striking. You said it is important to actually give also support to caregivers as well, which I think is a very big demographic that might be going through a whole other completely difficult situation that is completely overlooked as well. So thank you for bringing that to our attention as well, and just being able to give us the difference between disorders and mental illnesses as well, I think was fantastic, and we are very excited to have learned that tonight. So we, as usual, got a few questions that I'd just like to read one or two so that we can get to feel the response of the individuals that we are looking into. And someone said, can mental illness be escalated from as like to something with a more complex name like
I think I missed the last part. Kindly come back again.
all right. The question is, can mental illness be escalated from smaller triggers like stress to something with a more complex name like schizophrenia or a bipolar?
Um, it is a no. It's a no and a yes, because of course some of the complex mental health issues come associated with so many other things. Some of them are almost associated even with physical illness or some issues. You remember we were talking last time about the brain chemistry, or how our brain is made. And of course, if there is a disorder in our chemical composition of the brain, then we are predisposed to some mental illnesses. So all mental health issues are not directly associated with stress. So it is not obvious that if someone has a mental health issue, that there is some stress associated with it. And that's why this can only be determined by an healthy professional. So it is important to get to really know uh, the root cause. And that can only be done when chemical tests are done on our body to be able to get the root cause. I remember last time when we were having a discussion, I said I had a case of someone who had issues with their thyroid function. And because of the thyroid function, there was extreme impact in depression. It was so bad. Immediately they were treated of the thyroid dysfunction. The depression ended completely. So sometimes it is not an obvious answer. It is not something obvious. But then if we are stressed in any way, it is important to seek help, seek support, seek medical support, seek counseling, seek therapy, talk to someone. But of course, I know sometimes when we say talk to someone, we think we just can talk to our friends. Our friends, the much they can be able to tell us, it's man up. Others will tell us grow up. And that is all they know. So if there is stress, if there is something that has been very stressful or traumatic that you've gone through, it is important to seek counseling or therapy so that it doesn't escalate to maybe now depression and other mental illnesses.
Mm, that's well said. Well said. Stress is not always the leading cause to mental illness. Sometimes it's just a matter of brain chemistry. And I think this is why it's important to have a medical professional, or rather a professional in the mental health sphere who can actually be able to see the signs and just direct whether we need a medical test or we need to go through this in the therapy way. Thank you for that. Someone brought in a very personal question and they said, I recently started a new job that got super difficult 3 months into it. I have not been sleeping, so I decided to start taking Piritons and a glass of wine regularly to help. Is this bad? Is there another way to get good sleep patterns with such a stressful situation? Stress seems to be coming up a lot today.
Now, that is self-medication. Whether it is with alcohol or with wine or with Piriton, that is self-medication. And self-medication can be, of course, you realize you don't really know how far this can go. Sometimes many over-the-counter medication can be addictive, including Piriton. So the body might become dependent on this particular medication, and there is no way to stop. So now, instead of treating the stressful situation at work, we now start treating addiction. And it is the same addiction that we will also treat addiction of alcohol or other drugs. So when we self-medicate, including when we self-medicate on stress or any traumatic experience we have gone through, maybe just speaking to a counselor would have helped you to manage that situation at work better than self-medicating on alcohol, drug, or even that Piriton that looks innocent. That same, the Piriton, when Piriton stops working, we will go for a stronger one. And before we know it, we are in a whole chain of addiction that we have now added to the pain or the stress that is happening at work. So anytime you find yourself in an overwhelming situation of any kind, be it work, be it financial challenges, be it trauma, pain, anything that you are going through, seek a counselor. It is easier going through that situation with a therapist than having to take alcohol and becoming a drug addict.
You start evading actually treating the main issue, and you find yourself getting into a deeper hole by making yourself maybe turn into something that you are definitely not planning to do. Wow. And self-medication over the counter, you have no idea what you're doing, and you also don't know what triggers, or rather the kind of chemistry that you have in you, and what it can do by actually bringing in some drugs, especially that regularly. If she says that she had to take the wine and the Puritans regularly so that she could actually have a pattern of sleep. Thank you for that. Um, there's this one who says, how do we help my uncle who keeps getting scared from bangs, loud sounds, has terrible nightmares and does not sleep, and he hates his former friends who were in the military with him? Mm.
Of course, that explanation is an indicator of anxiety disorders. There is panic and there is anxiety, but it might also have a combination of depression.
Mm.
There is also post-traumatic disorder.
Yeah.
So being that of course there is that history of the nature of work and the environment this person was in, they may require urgent attention. Help is not talking to them. Help is taking them to a health professional who is trained in matters mental illness. I said the person may be dealing with anxiety, there is panic, there is post-traumatic stress disorder, and there is depression. So a combination of all that, because of the environment, the work environment this person is coming from. And sometimes, of course, because of the nature of our work, it is important to constantly see a therapist to just go through those traumatic events, because the body has not, the way we are designed as human beings, we are not designed with the stamina to handle very painful traumatic events. So when those events happen, there is something they mess up with us. Of course, they will mess up with our mind, they'll mess up with our emotions, our feelings, and definitely that has a mental, a physical implication, but it also has a serious challenge in matters of behavior. So no one is strong enough to go through trauma. No one is strong enough to go through stressful situations. None is strong enough to go through a traumatic event, including things like when we've had floods in Kenya just the other day. Even what we went through, the many times we've had political unrest, even experiencing a person being shot, all those things don't leave you the same. So it is important when you are exposed to such things, it is important to seek support, because they can have a mental illness implication in your life.
Wow. Thank you for that, and for just bringing to light that anything traumatic can actually bring some mental illness that can follow, such as a traumatic experience like the floods that we had. Maybe some people are actually going through some things, and they're really trying to wonder where is this behavior coming from, and they are not able to bring it together with the traumatic experiences that they were able to get. Maybe we can just go a bit deeper into that question. is it possible for maybe someone to be able to see how they can actually piece together a certain traumatic experience with a mental illness that they may be experiencing? Is there a that we can know this behavior is coming from a
Remember,
specific traumatic
ment
event?
sorry, mental disturbance does not present
Mm-hmm.
itself as a sickness.
Mm.
It presents itself as a behavior. So the behavior may be sadness, the behavior may
Yeah.
be anger, the behavior may be aggression, the behavior may be isolation. So because there is no physical pain associated with mental health issues,
Mm-hmm.
by the time I am reaching a point of it being called a mental illness, a lot has already happened. That's why a best way of prevention is if you've gone through a traumatic experience, let's say loss of a loved one, seek support early. You are involved in an environment of a war zone, a place like maybe now the brother we were talking about there, who has been in the army, and all those challenges that happen around those work environments. If you've been in such places, it is important to seek help even before you start experiencing symptoms. Because by the time we are seeing it as behavior, it has already messed with your mind. It has already messed up with your relationships. You have already started maybe even fighting and becoming aggressive, or you have even committed a crime by the time we are seeing it in behavior. Many of the homicides that happen in our nation, Amy, they are directly associated with mental illnesses. It is a mental disturbance that was overlooked. I became very depressed and anxious over something. And because the aggression, the anger, the pain was not dealt with early, by the time I am presenting myself, I have already committed a crime. So the prevention measure would be more of seek help immediately.
Yeah.
And
Seek
nowadays,
help
now it's not
immediately.
like the time we are coming from, where mental awareness was not there. Most of our hospitals now
Yeah.
have counselors, of course, not sufficient, because some of them will only have one or two. But there is help all around. We are not like where we have come from. So seek help early
Mm-hmm.
before you start experiencing symptoms, because by the time the symptoms are showing up, it might be too late.
Yeah. Wow. Seek help early because by the time the symptoms are showing up, it might be too late. You might be in a fix, and it's really just important to find help. And Madam Kate, today you've mentioned a lot of professionals. You've said find someone who is trained. By this, do you mean a regular doctor? Like, can you go to a doctor's office and say, "I'm here because I feel like I have a mental illness," or is there a specific area, or how do you know somebody has been trained to deal with mental wellness?
A general doctor will treat anything, or will be able to refer you to the right channel. I said a general doctor, a doctor that has been
Yeah.
trained in everything.
Yes.
But it is important to seek support from a psychologist, a
Mm-hmm.
counselor, or a
Mm-hmm.
psychiatrist.
Okay.
I said a counselor, a
Mm-hmm.
psychologist,
Or a
or
psychiatrist.
a psychiatrist. A
Mm-hmm.
psychiatrist is now the doctor that is trained in matters the brain and mental health. Of course, They're the ones that will administer the drugs. The psychologist will do the tests. The counselor will do the therapy.
So you can fine. So the psychiatrist is the one who does the medication, and he's been trained to do the medical side of it as well as the mental of it. The psychologist will do the testing, and the counselor is the therapist who is able to do the therapy and being able to talk you through some of the situations. Fantastic. So I believe that is something that our viewers will take into consideration whenever they are looking for a mental health assistance, or if they are looking to find a professional who can help them through whatever they may be going through or whatever their loved ones might be going through. So, Madam K, we've also spoken a little about caregivers today, and we would like maybe to know how to give good support, to a caregiver, or how a caregiver should care for themselves as well when they are taking care of their loved ones, or if they are the ones who are dealing with the stigma that the society might be throwing towards their family, because maybe the person who is unwell is not necessarily feeling the stigma at that point.
Mental health patients are not easy, because remember, most of the times they are living out of the reality. So the decisions they make concerning their own life are dependent on the caregiver. We are talking of their feeding, their dressing, where they sleep. They are totally dependent on, at that particular time when they are unwell, they are depending on this caregiver who is the one making decisions on their behalf, because they are not able to, especially the extreme cases of mental illness. And what I just explained is not easy, because it means taking care of my own mental wellness and taking care of the wellness of a sick person.
Yeah.
And also now taking care of the society that does not understand my sick patient. It can be overwhelming. So of course, once in a while, the caregiver, it's also important to seek professional help, to just go pour out the frustrations and the pain to someone, because you may take care of a mental illness patient, and you also become a patient yourself. It is very easy for one to become sick by taking care of a person that is mentally ill. I've dealt with a case of one that was sick for a while, I think close to 3-4 years. And the caregiver, because they were not able to sleep through the night, they got very bad high blood pressure, which they had to take medication for quite a while for them to be able to stabilize. These are very young person, but the high blood pressure was reduced because of the environment that person was in for a long time. So it is a very, very tricky environment, especially for the caregiver. There are support groups, of course, that offer the same. Sometimes in our hospitals, of course, we will find such. I don't know whether in the churches we are doing well in that area. I can assure you we are not. Those are other places that we would have support systems for such people, where at least you can come and talk about the pains of being a caregiver. So some of those things are not available. So, but for the time being, therapy would really help that caregiver, because it is not easy. And remember, you cannot leave this person on their own. So it almost makes you feel like this person is my responsibility. Yet you also have your very own responsibility. So it's a heavy, heavy task that these people are going through, and we pray for strength, even as, of course, there may be people listening to us, and that is the very situation they are in right now.
Wow. I think this is such a forgotten, if I may say, forgotten demographic. And just like you've mentioned, I think right there you have posed such a challenge even to us as professionals is just to make sure that we are helping our clients and our people to just be able to find support groups and be able to connect with one another so that they can actually walk themselves through this journey that might not have the mental health professional with them on a daily basis. So thank you for that. Thank you for all the information that you have actually given to us so generously tonight. As you can see, I've done my notes once again, and I'm so glad to have been part of this class tonight. And maybe just to give a brief summary of who we are. We are Salem consultants. My name is Amy Njambi. I am a counseling psychologist there. And in case you, and this is of course Madam Anne Karam, who is our head psychologist and counseling psychologist there as well. And if you, any of you or somebody that you know is in need of therapy or is in need of counseling, feel free to go onto our website at www.salemconsultants.co.ke, and you will be able to book an appointment there for yourself, or to find our contact where you can reach out to us, and we will be very, very happy to get in touch with you. You can also reach us on 0104 168 166, and we shall be able to get in touch with you over the same as well. So we are looking forward to having you with us. And Madam K, over to you so that we can just close the meeting.
Thank you so much, Amy, also for those questions. I believe they were able to be educative, and also it will create awareness and just help us and help the population to just be able to know how do we offer support to people that are having mental health challenges, and also avoid to become people that cause stigma to the patients that are going through this, and especially also the caregivers that are 100% depending on the patient who is not able to make sometimes decisions for themselves. So thank you so much. See you once again next week. Next week, we'll be meeting on Tuesday. There was a mix-up this week. We will be meeting Tuesday, same time. So tomorrow, we'll be having a different session altogether. But next week, we meet Tuesday, 8:30. And we'll be, of course, again, talking to us about a different topic altogether in matters mental wellness. Thank you so much, and may the Lord bless you.